Which of the following organisms is most likely responsible for this patient's condition? Another pathogen question. 32-year-old HIV positive man, so immunocompromised, presents to clinic with multiple erythematous nodular lesions on his skin. Lesions are tender and have appeared progressively over the last month. Biopsy, one of the lesions shows neutrophilic infiltrate and blood-filled spaces lined by endothelial cells. All right, HIV positive, so immunocompromised, multiple erythematous nodules, erythema nodosa. Um, and a biopsy of the lesion shows neutrophilic infiltrate. Um, erythema nodosa. What is that usually? Which of the following shows neutrophilic infiltrate and blood-filled spaces? Uh, oh, my internet is not stable right now. Sorry. Uh, Not Candida. Candida is a yeast, does not do that. Bartonella henselae. Bartonella is, I think, more associated with like an animal reservoir. I don't remember which one, but yeah, Mycobacterium tuberculosis atypical pneumonia. That's not it. Treponema pallidum. I am not Staph aureus. Staph aureus would not have erythema nodosa. I'm leaning towards treponema.
Okay, final answer.
Uh, yeah, let's go with that.
Okay, so
Good job.
let's work this. So erythema nodosum, you got that correct, right? Biopsy, neutrophil infiltrate blood spills with this and consists of bacillary angiomatosis. That's why there's a lot of blood in endothelium cells. So you kind of have to know this. It is correct that you say it's usually an animal reservoir like cats, but remember, in HIV patients, right, they get weird stuff without being exposed to the normal stuff, right? So Staph aureus, right, that's going to give like abscesses, cellulitis, and impetigo, right? So really, really nasty stuff that you see on the skin red, not really erythema nodosum. TB, right? You can get cutaneous TB, but usually are painless, and then ulcers, plaque nodules, and then you'll have granulomas, right? Which is with casein necrosis. That's going to be very, very key here. Treponema pallidum, which is syphilis, right? Various causes of skin, right, depending on the stage, but usually shows dense lymphoplastic infiltrate and into the cell, but not blood-filled spaces. So the key thing is that there's a lot of blood, right? So
Yeah.
bacillary angiomatosis. So angiomatosis just means like, blood vessels, right? And
Uh-huh.
then Candida albicans, right? You can get kind of some patches and whatnot, but not nodular regions, and it's going to be fungus, right? But yeah, so just best answer here is going to be Bartonella henselae, right? But yeah, this is kind of one of the things that you have to put in your repertoire. Like HIV patients, right? They're going to have really weird diseases, right? And their presentation can be, just the fact that it doesn't have to be, by a regular cat, because that's for competent people, meaning they have an immune system. So you're going to be looking for a history of a cat scratch or something like that. But
Mm.
HIV people, you have to kind of think to yourself, oh, it can be anything, right? That is susceptible for someone that's immunocompromised. In this case, right, Bartonella henselae, which has that very specific histology finding, which is the blood fill space line with endothelial cell, which is just very small capillaries if you think about it. So, angiomatosis, that's why they call it that.
Got it. Okay.